provides instructions for the 3M Bair Hugger Warming Unit Model 675 and is intended for clinicians only. The Bair Hugger Warming Unit Model 675 can be connected to all Bair Hugger warming blankets and gowns for clinical warming in the intra-op and post-op settings, where it can help prevent and treat hypothermia. The Bair Hugger system is contraindicated for use on patient lower extremities during aortic cross-clamping. Prior to use, consult detailed product indications, limitations, safety information, and instructions in the provided operator's manual and preventive maintenance manual. Additional safety information specific to the product is available at the end of the video. The 3M Bair Hugger Warming Unit Model 675 consists of a control panel with LCD display, a carrying handle, power cord, detachable warming hose, IV pole mount, and an optional rolling cart. The 3M Bair Hugger Warming Unit Model 675 can be mounted on the available rolling cart or an IV pole. The unit can be easily removed from the rolling cart by gently pulling on the front tab on the cart and lifting the unit. When mounting the unit on an IV pole, twist the mounting screw clockwise to tighten. To prevent tipping, be sure the unit is mounted less than 44 inches, 112 centimeters, from the floor, and the IV pole wheelbase is at least 28 inches, 71 centimeters in diameter. Attach the warming hose to the warming unit on the side of the unit. Align the arrows on the hose C-collar to those on the unit to ensure a proper fit. Then push the hose in and twist clockwise to secure. To remove, twist the hose counterclockwise and pull. The warming hose can be gathered around the top of the warming unit and secured with the sheet clip when not in use. The hose can also be detached and stored in the base of the rolling cart for easy transport, cleaning, and storage. While the hose end does not incorporate a physical hose end sensor, Model 675 incorporates an updated software that accurately reflects the temperature at the end of the hose and displays on the LCD screen. Connect the warming unit power cord to a properly grounded power source. The LCD display will illuminate and quickly change to the Bair Hugger branding. An audible beep will sound, and the power button and 4 temperature buttons will quickly flash green. The unit will immediately go into sleep mode, with the power button illuminating amber and the display screen going dark. At this point, the unit is ready to operate. To start operation, you can either press the power button to go into standby mode or directly begin warming by pressing one of the temperature selection buttons. During operation, the power button remains green. If no buttons are pressed, after 10 seconds the unit will enter sleep mode. To exit sleep mode, either press the power button or select a temperature button. Insert the end of the Bair Hugger warming unit hose into the Bair Hugger warming blanket or gown hose port. A stop collar around the midsection of the hose end prevents over-insertion of the hose. Check to be sure the patient is not lying on the warming hose or does not have direct skin contact with the hose. Do not treat patients with the warming unit hose alone. Always attach to a Bair Hugger warming gown or blanket. You should support the hose by attaching a tethered sheet clip to the OR bed or IV pole. To help provide a secure attachment, you can adjust the tether along the length of the hose. There are 4 temperature settings: ambient air at room temperature, low at 32 degrees Celsius, medium at 38 degrees Celsius, and high at 43 degrees Celsius, enabling the delivery of effective forced air warming as required by each individual patient. To begin operation of warming therapy, be sure the unit is in standby mode by pressing the power button if it is illuminated amber. Select your required temperature. The display screen will show the real-time temperature in degrees Celsius as it warms up. The 675 features one airflow setting, which provides effective heat transfer for anesthetized patients. Solventum recommends continuously monitoring core temperature. In the absence of continuous monitoring, monitor the temperature of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes, or according to your institutional protocol. Discontinue warming therapy when the temperature goal has been achieved. The Model 675 unit has both visible and audible alarms. The visible indication will show in the LCD display. The wrench indicates service is required. The red thermometer indicates over temperature, and the blue thermometer indicates under temperature. Whenever an alarm symbol appears, an alarm will sound, and the unit will be inoperable. The blower and heater will turn off. Press the power button to silence the alarm. Do not restart the unit. It should be unplugged and removed from use for service inspection by a qualified service technician. The Model 675 unit has a diagnostic mode that allows access to the service and calibration utilities of the unit. To access the diagnostic mode from the sleep mode, first press the power button to enter standby mode. Then press and hold the Bair Hugger logo for 3 seconds. The menu will appear on the display. Use the 32 and 38 degree temperature buttons to scroll up and down. Select options by pressing the ambient air button. To return to the previous menu, press the Bair Hugger logo. To exit the diagnostic mode, press the power button to return to sleep mode. When warming therapy is complete, press the power button to return to standby mode. Unplug the warming unit from the power source once finished using the system. Remove and dispose of the single-use warming blanket or gown disposable per facility protocol. Once disconnected from the power source, perform cleaning in accordance with facility protocols. Wipe the warming unit and the outside of the warming unit hose with a damp, soft cloth and a hospital-approved mild detergent, germicidal disposable wipes, disinfecting towelettes, or antimicrobial spray after every use. Consult the operator's manual for recommended cleaning solutions. When the filter time limit has been reached, the filter change indicator will appear on the bottom right corner of the LCD display. Continue with the current use. When finished, the filter should be changed by service personnel. Do not attempt to replace the filter while the unit is still in use, or to clean the air filter as it may be contaminated from use. Discard in a manner consistent with your facility protocol. The Bair Hugger Model 675 warming unit contains a MERV 14 rated filter. To keep your warming unit running at maximum efficiency, this filter should be changed every 12 months or after 500 operating hours. Once the filter has been replaced, the filter timer should be reset. Use the diagnostic menu to locate and reset the filter usage counter, following the menu navigation explained earlier. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on the risk of thermal injury, altered drug delivery, interference with ventilation, patient falls, and hazardous voltage and fire, applicable to the use of the 3M Bair Hugger Warming Unit Model 675, which can be found in the device operator's manual provided with the warming unit. The Bair Hugger warming system should only be used by trained medical professionals. If you have product questions, please contact your local Solventum representative. Call the Solventum customer care at 800-228-3957 or visit solventum.com. Solventum offers device training upon request.